The Doc is In is sponsored by Amada Senior Care.
We're happy to have Chief Medical Contributor Dr. Ryan Stanton with us back for another look at a health condition in the Commonwealth.
That's right. Earlier he talked about a large number of croup cases going around, and now you have some tips of how to manage it.
Yeah, so it's going around. It's actually the major player that we're seeing in infections around the region right now. So it is the major one. If you're infected, especially if you're kids, good chance it's going to be croup. So let's kind of advance the story here. As we mentioned earlier, we're seeing a ton of croup in our region right now that is associated with cough, fever, shortness of breath, and occasionally stridor. A coarse sound when you breathe in from a narrowing of the airway. Most cases are self-limiting and require nothing more than some symptom management. For most children that present with acute symptoms, they will get a single dose of steroids, which can help decrease some of that severity of symptoms and inflammation. This is a viral illness caused by the adenovirus, so antibiotics are not indicated or are useful in this. Some things you can do at home include a cool mist humidifier, standing in the bathroom with a warm shower running for about 20 minutes, or even going outdoors once it gets a little bit cooler for about 10 to 15 minutes. We find that children, many of which are feeling better after the journey to the ER because of those cooler air temperatures that they're exposed to. In more severe cases, the patient may receive a type of epinephrine nebulizer treatment that may require more invasive interventions as well, and even potentially admission to the hospital. If you have any concerns with your child, especially with worsening shortness of breath or stridor, seek care right away. This is one of those that has that full breadth of potential with it, very mild in the vast majority, but it can be quite severe, especially in the very young, just because of those airways narrowing up. And in adults, this manifests as laryngitis. So when you see that upper respiratory infection and that loss of voice, it's going to be the same virus as well.
It has to be really scary for a parent. You hear your child making that kind of noise.
It is, and it's when they breathe in, they try to work really hard to breathe in. Accessory muscles and that sound, yeah, can be very difficult and very frightening, but we're always there in case you need us.